Hello, my name's Andrew Shepherd. I'm an orthopaedic surgeon working in Warwickshire. I'd like to talk to you today about osteoarthritis and hip replacement surgery. What is osteoarthritis? Osteoarthritis is where the lubricant surface of the hip joint becomes worn away. This often happens as we get older and also can be caused by damage to the joint in earlier life. As the arthritis progresses, the lubricant surface becomes thinner and thinner. Eventually it wears through, exposing the bone underneath. This can be very painful and is often when patients are referred to me. This X-ray shows the difference between a normal hip and a hip with osteoarthritis. The X-ray on the left shows a clear gap between the ball and the socket. The X-ray on the right shows an arthritic joint with features such as narrowing of the joint space, small holes in the bone, and extra spurs called osteophytes. What symptoms do you get with hip arthritis? Typically, patients who have osteoarthritis of the hip get an aching felt deep in the front of the groin. It sometimes spreads down the front of the thigh towards the knee. They often get a pain after activity, and it's relieved by rest or simple painkillers. They can also experience stiffness in the joint. This could mean they have difficulty tying up their shoelaces or cutting their toenails. As the symptoms get worse, they often find it keeps them awake at night, and their ability to walk gets less and less. What are the treatment options? Patients with osteoarthritis of the hip should initially be managed with non-surgical treatments such as weight loss, walking aids, physiotherapy, and pain-killing medications. Sometimes an injection into the hip joint with local anaesthetic and steroid is recommended. None of these treatments cure the arthritis, but it's very reasonable to try and mask the symptoms of the disease before considering surgery. Total hip replacements have been around for about 60 years and it's one of the best operations in the history of medicine. Although it's a routine procedure, it is a big operation and most patients take about 3 months to fully recover. Typically, patients are admitted on the day of their surgery. Most have a spinal anaesthetic with sedation. This is when local anaesthetic is injected into the low back so they cannot feel pain during the procedure. They also have some sedation so they're not aware of the operation. The surgery is done through a minimally invasive approach. My preferred method is a minimally invasive posterior approach using special equipment to reduce damage to muscle and tendons. The hip replacement itself is made out of titanium with a special coating called hydroxyapatite that mimics natural bone. Once the implant is inserted into the hip, the skeleton grows into the implant and forms a strong bond that lasts many years. The bearing surface itself is made of a ceramic head with a dense plastic liner. This is the best performing option for patients who wish to get back to a high level of activity. As soon as the new hip has been inserted, it's stable enough in the bone for patients to get up and walk around with crutches. Typically, patients go home the next day and use crutches for a week or two whilst the soft tissues are healing. By 6 weeks, most patients no longer need any walking aids and are back to activities such as driving. By 2 to 3 months following the surgery, patients have usually made a full recovery and are back to sports and other more demanding physical activities.